The Ghana Psychological Association has raised alarm over a severe mental health gap in the country, revealing that less than 20 clinical psychologists are currently employed by the government, with most based in the Greater Accra region and only a few in the Ashanti region. This means 14 out of 16 regions have no government-employed clinical psychologists at all, leaving millions of Ghanaians, especially in the underserved areas, without access to essential mental health services. The association's president, Dr. Richmond Akwa Coleman, is also urging the government to support the integration of mental health screening into primary health care, a move he believes will reduce stigma and help more people seek support early. He made these remarks at the launch of this year's Psychology Week celebration and annual general meeting.
In fact, it will interest you to know that if you take the Ghana health sector, for example, psychologists that are practicing in there that have been employed by government, they are not even more than 20. In fact, a lot of them, majority of them are even in Accra. If you go to other parts of the country, the northern areas, in fact, there are some areas there's no psychologists there, and that is very, very worrying. So for us, we want to appeal to government to look into the employment of clinical psychologists and counselors into the system to support primary health care. In fact, we even want to integrate mental health into primary health care. So as part of the assessment that we do to people that visit the hospital, we also want to check their mental health as well, because normally when you direct them to go to specialized psychiatric hospital, they do not want to go because of the stigma that is associated with it. But if they go to any hospital as part of the OPD activities and their mental health is also checked as well, sometimes they will not even see it to be a problem. We also want to appeal to government also to also look into the remuneration. In fact, one of the reasons why a lot of people are not into the system is not because we do not have enough psychologists. We do, but just because it is not attractive. So many of them are leaving the practice and even joining academia to come and teach and all that. So we should also look at it and make it more attractive.
Now, President Mahama is urging the Bank of Ghana to step up public education and public awareness on proper handling of the CD. Now, speaking at the CD at 60th anniversary conference, the president renewed his pledge to preserve the independence of the central bank. The Ghanaian currency also continues to suffer widespread misuse and careless handling across the country. Now, many as well. Well, before I bring you that story, let me take you back as well also to the conversation on the mental health, where we're bringing you a conversation with Dr. Akwa Coleman. Doctor, thank you for joining us this afternoon. I'll take our audience back to the CD conversation, but back to the psychologist conversation that we started. I'm told for the district hospitals across the country, there are 12 clinical psychologists, less than 20 government employed, for teaching and other big health facilities as well. Explain these figures better. How did we as a country get to this point?
Okay, so good afternoon, and good afternoon to our cherished listeners. Let me be a bit specific and explain this quite well. So I indicated that within the Ghana Health sector, and here I was referring to the Ghana Health Service. And Ghana Health Service basically is in charge of the district hospitals, regional hospitals, and those local community hospitals. And within that sector alone, we have about 12 psychologists. In fact, we have 6 in Accra. And in Accra, we are talking about Achimota, we are talking about Lekma, we are talking about Ga East, Ga West, Tema, and that's all. If you go to Kumasi, for example, there used to be one at Tafu. That person is not there again. So in Kumasi, the whole of that region, for example, there's no psychologist there. In Ho, there's no psychologist. So I was actually making reference to the Ghana Health Service. But when you go to the teaching hospitals, which are autonomous and they are actually under the Ministry of Health, there you will see a certain number, but even that one, they are concentrated in Kolebu. Kolebu alone, and of course in Accra, Kolebu alone has about 24, and then you have 37 having, let's say, about 14. The rest, which is Konfanochi, has only 1. If you go to Cape Coast Central Teaching Hospital, they have 2, and I think Tamale 1 or so. And you see, the problem is that when you have a situation where a lot of the psychologists are rather in the teaching hospitals, but at the regional district level, there are no psychologists. It means that primary, secondary cases become neglected. And of course, it's not, you don't directly assess some of the teaching hospitals. So the problem is that people are not able to assess psychological service. And that is very, very worrying. And all these things as a result of the fact that we have really paid very lip service to mental health issues in the country. Yes, we talk about it. We know how devastating it can be. But the investment, the personnel, bringing in people and resourcing them to work has always been an issue. And for example, the problem is that the psychologists that used to be in the system, they have all left. Some have left, traveled outside to go and work, majority of them. Others have also moved into training institutions to go and teach as lecturers and what have you because the pay is a bit better. And government is not bothered in doing something about it to bring them into the system. Because it takes about 7 years to train as a psychologist. Yet when they enter the health system, they are placed as 4 years or first degree holders. And that is a bit non-rewarding. And so many of them are leaving. This is one of the reasons why we are where we are. But the most important thing is that we have not really invested in mental health issues. For example, as we speak, the Ghana Psychology Council, all the health professionals, their board has been inaugurated. The psychology board, the Ghana Psychology Council, for example, as we sit, the board has not been inaugurated. We still do not have a board. A lot of things are happening among our membership that has to be done, even for licensure, for CPDs, and all these things have not been done. So we are really appealing to government to pay more than the usual attention to mental health issues in Ghana, because at some point in time, we are going to be overtaken by a mental health issue. If you look at the inflation of mental health in the country, it is something we have to start doing something about.
I mean, you have just drawn my attention to another critical point where I'm just wondering, in this case, what type of mental health cases are nearly going untreated?
Basically, you know, at the primary level, there are a lot of issues that may not be disordered, where people are not necessarily suffering from, if you like, depression disorder, anxiety disorder, or schizophrenia, or what have you. But people are dealing with issues, for example, sleep. They are not able to control their emotion. They just want somebody to speak to. For example, there are instances where somebody has to take some surgery, and the person is afraid. And as a result of that, he's even contemplating whether to do the surgery or not. And perhaps may not even go, or even when the person goes, because he's not mentally ready, it may have some other repercussions. So all these things, because there are no psychologists or counselors around to support or what we call liaison mental health, many of these things are not properly handled. So people go into sometimes even physical medical care when their mind is not ready.
Right.
Again, we are also seeing situations where now people are rather resorting to other people who are more or less like they are counselors, but they are not trained, just because they want people they can speak to and they are not getting that. And the issues of depression, anxiety, suicidal issues, they are all because we are not screening some of these signals or symptoms right from the beginning. Because there are instances where people go to the hospital, they can be checked, their vitals and everything could be checked, and they think, okay, something could be wrong with them, perhaps at the workplace, at home, and all that. But we are not paying attention to that. We focus more on the physical aspect.
Right.
And eventually it degenerates into something that now gets out of hand. So we want mental health care, treatment, assessment should be part of primary health care. So that when people go to the hospital, as part of taking their vitals, we are also taking their mental health. We are screening them for some other mental health conditions so that as quickly as possible, it can be addressed or prevented before it gets out of hand.
Dr. Akwa-Coleman, thank you for drawing the country's attention to this very important issue.
Thank you very much.